Rough. I'm Fred Arnold. Welcome to the Women's Entrepreneur Edition. My co-host, Tara McHugh.
Hello, Fred.
Well, it's great to have you back in the studio.
Thank you for having me.
And I know we have a big lineup of great guests because our number one job is to help people get out of the rough and into success and help them strive every day in life.
Yes, so I brought some wonderful guests with us to share some wisdom and strategies.
Well, tell me about Dr. Griffin.
Sure, this is Dr. Carolyn Griffin, also known as Dr. G. That's what I like to call her.
I like that.
Yeah, she's a local chiropractor here in Santa Clarita.
Yeah.
For over 18 years. I can't believe it. She doesn't look that old.
Started when I was 12.
Yep, I like it.
Clearly.
Good answer. Very
Yes,
good.
so we're going to talk about chiropractic.
Okay.
So why do people go to a chiropractor?
You know, when people think about chiropractic, they think neck pain and low back pain, and rightly so because we do a really great job of that. But we also have people that come to our office for other conditions like headaches or digestive conditions or sinus infections, and even just help to boost the immune system.
Nice.
Well, it brings, my thought was stress. Getting rid of that stress that you have in your body.
Yes.
That leads to so many different challenges people have.
Absolutely. When you're stressed out, what happens to your muscles? They tighten up. And when that tightens up, it can pull the vertebrae out of alignment, which can cause and irritate a nerve. And those nerves go to all your vital organs, muscles, tissues, glands, and cells. It makes your body work and function.
Well, they talk about being in alignment, and that's really what it's all about. How does chiropractor really help, though? Tell me more about the essence of what you do.
Well, when we take care of a patient, when they come in, what we're looking for, when you go to a dentist, they're looking for cavities. When they come to a chiropractor, we're looking for subluxations. And a subluxation...
Say it again.
Subluxation.
I like that, okay.
Yeah. So a subluxation is when two bones are shifted out of their normal alignment, and it can pinch and irritate a nerve. And those nerves, like I said, go to all your vital organs, muscles, tissues, glands, and cells. So if you have a subluxation pinching on a nerve, what do you think is going to happen to, say, an organ at the end of that pinched nerve?
Probably wouldn't function properly.
Exactly. And if your organs don't function properly, your overall health tends to go down. So a subluxation, pinching a nerve, doesn't just cause pain like everyone associates a pinched nerve with. It can actually make your body not work or function well either. And what's interesting is only about 15% of your nervous system is pain perception. The other 85% is body function. And the biggest mistake everyone makes is they bank 100% of their health on only 15% of what they feel. They think if they're not in pain that they're okay, and that's not always the case.
Yeah, the 80-15 rule. Well, it used to be a 80-20, and then now I think it's 90-10.
Yeah.
Yeah, that's fabulous.
Well, so it's not just for injury, it's also for prevention.
Yeah, it helps your body to function better.
I love it.
Yeah, wellness.
Overall health.
Yeah. So you've been a chiropractor for over 18 years.
Yes, I am.
Which is, I still can't believe it. But, so what trends do you see?
Yeah, you know what's interesting is a lot of times years ago we'd have a person come in with low back pain and they get their back adjusted and they'll feel better and then they'll go on their way. But what we're noticing is people aren't necessarily coming in because of the pain that they're experiencing, but how it's affecting their life in a negative way. So for example, a person when they come in with their low back pain, they may actually want to be losing weight, but they can't work out as a result of their pain. So what they're doing, or if they have children, they're not able to lift their children anymore because maybe their neck is killing them. So it's preventing them from actually doing the things that they really want to do.
Yeah, what's amazing is one thing leads to another.
Always.
Which is what you're looking for, and it's about wellness, isn't it?
Yes, yes it is.
Yeah.
What I love about Dr. G is she's very much into educating people. When you go to her office, she's got TV screens and things just to even educate your patients. Right. But I know you do some outreach with local businesses and other organizations. So.
We do a lot of community outreach. It's our way of giving back. I've been in this practicing for over 18 years, but in Santa Clarita for over 15. And so what we want to do is we just want to give back to our community. It's been great. I love Santa Clarita. We've been here, raised my children here. And so we go to different businesses and we educate them on a healthy lifestyle. And so what we're finding is that people don't know a lot of stuff. Things that might seem quite easy for us, it just comes naturally. They just don't understand the concept of wellness. They're watching a lot of television and maybe they're learning things that aren't necessarily healthy. So we're giving them the tools to live a healthier lifestyle.
Well, you just said something. They're watching a lot of television. And the one thing I'll say is you're very fit yourself.
Yes.
I know that fitness is important to you, and you both work out together. I know. And
we actually haven't done it together. We go to the same gym.
Right.
But yeah, we need to do it together.
We should.
But what's great about that is you're practicing what you're preaching.
Yes.
And I think that's very authentic.
Thank you.
Yeah. Those who want to reach out to you and get well,
Yeah. 661-250-1517. That's our phone number. And we are getting ready to move our practice to Golden Valley. It's going to be great. We're moving by summer. It's going to be awesome.
Very good. Ladies and gentlemen, Dr. Carolyn Griffin, Doctor of Chiropractor in the Santa Clarita Valley.
Thank you so much.
Great job.
Nice.
Thank you very much. We're going to jump to a quick break, and we'll be right back.